So, hello students. Now that you've understood the infratemporal fossa, you've understood the boundaries of infratemporal fossa, we've seen the contents of infratemporal fossa. To begin with, the pterygoid venous plexus, the pterygoids, the mandibular nerve, and the maxillary artery. Right? These are the contents. So, we've seen the mandibular nerve in detail, students. Let us understand the maxillary artery. Maxillary artery, another very important topic, very important MCQ for you, the maxillary artery. Have a look at this. Okay, we begin with this maxillary artery. Now, once again, coming to this, that's the ramus. I mean, that's the body of the mandible. And what is this going to be? One moment. What is this going to be? The ramus. I mean, this is going to be the ramus of the mandible. Ramus. We remove the ramus. These are the two muscles of mastication. What is this muscle? That's a lateral pterygoid and that's a medial pterygoid. Lateral pterygoid and medial pterygoid. Fine. Now, what is this artery? Students, what is this artery? That's the external carotid artery. Perfect. External carotid artery enters a gland here. There's a gland which lies here. There's a gland which lies exactly like this here. What's that gland? The parotid gland. Okay. That's a parotid gland. Okay. And in this parotid gland, the external carotid artery divides into two terminal branches. Number one, the artery which goes up in the temporal region. We have a headache and this artery starts to pulsate. We have a severe headache. If you feel, you can feel this artery here. What's this artery in the temporal region? The superficial temporal artery. That's the superficial temporal artery, a terminal branch of external carotid. The second artery is going to be the maxillary artery. Maxillary artery, a terminal branch given in the parotid gland. Now, this maxillary artery would pass deep to, yes, students, it would pass to deep to the ramus of the mandible, right? That's the ramus of the mandible here. This artery would go deep to the ramus of the mandible. It would enter the infratemporal fossa. Right. In this infratemporal fossa, this maxillary artery lies on which muscle? Look at this. What is this muscle? That's a medial pterygoid. And what is this muscle? That's the lateral pterygoid. Lateral pterygoid. So the maxillary artery is lying on which muscle? The lateral pterygoid. Lateral pterygoid. And this lateral pterygoid is going to divide the maxillary artery into three parts. Number one, from its beginning to the lateral pterygoid. That's the first part. From its beginning means from the external carotid to the lateral pterygoid. That's the first part. The second part lies on the lateral pterygoid. It is lying on the lateral pterygoid. And the third part goes between the two heads of the lateral pterygoid. What is this head? Upper head. What is this head? Lower head. So between these two heads of lateral pterygoid, the third part goes deep to it, inside it, and enters the pterygopalatine fossa. It goes in the pterygopalatine fossa. Clear? So maxillary artery is divided into three parts by whom? Lateral pterygoid. Lateral pterygoid. Anything else? Any other artery divided into three parts? Any guesses? The subclavian artery. Students, the subclavian artery is also divided into three parts by a muscle. Which muscle is that? Scalenus anterior. Scalenus anterior. So subclavian artery divided into three parts by the scalenus anterior. Maxillary artery divided into three parts by the lateral pterygoid. First part is from its beginning to the muscle. Second part is on the muscle. And the third part goes between the two heads, the upper head and the lower head of lateral pterygoid. It goes in the infratemporal fossa, which lies on the medial aspect of the pterygopalatine fossa. We'll see this later. The lateral pterygoid we'll see later. Clear, students? What is this nerve? Come on, I can see here a nerve. So what is this nerve? That's the inferior alveolar nerve. And what is this nerve, students? This was the thing which I was asking you in the last lecture. The nerve related to the last molar tooth. Is this clear? The nerve related to the last molar tooth. That's the lingual nerve. Lingual. Perfect. The nerve related to the last molar tooth is the lingual, not the inferior alveolar. Okay, fine. So now let us understand the branches of maxillary artery. First part, second part, third part. Okay, let us understand the branches of maxillary artery, students. So maxillary artery is a terminal branch of external carotid given in the parotid gland, goes deep to the ramus of the mandible, lies on the lateral pterygoid, divided into three parts by the lateral pterygoid. Okay, coming to the first part of the maxillary artery. First part is from its beginning to the muscle. Now, the first part gives, number one, deep auricular artery. Deep auricular, anterior tympanic, deep auricular, anterior tympanic. So these are two new branches for us, enters the ear. Now the rest are known to us. Middle meningeal, middle meningeal, middle meningeal artery. You know this, it enters the skull through foramen spinosum. We'll see this in the interior of skull. So middle meningeal artery enters the skull through the foramen spinosum. Fourth, accessory meningeal, accessory meningeal. Any idea where does this go through? This enters the skull through the foramen ovale. So accessory meningeal, and the last one is inferior alveolar artery. So these are all arteries. Deep auricular, anterior tympanic, middle meningeal artery enters the skull through the foramen spinosum. The accessory meningeal artery enters the skull through the foramen ovale. And the inferior alveolar artery, it goes with the inferior alveolar nerve, enters the mandibular foramen. We know this. Yes. So these are the 5 branches from the first part of the maxillary artery. You just need to know these branches. This is asked in the MCQs for you, students. Now, coming to the second part. Second part of maxillary artery. Students, how do you remember this? If you know the mandibular nerve, anterior division of mandibular nerve, you know the second part of maxillary artery. If you know the anterior division of mandibular nerve, automatically you know the second part of axillary artery. They're exactly similar. So what are the branches from the anterior division of mandibular nerve? 3 muscular, 1 sensory. 3 motor branches, 3 muscular branches, masseteric nerve, deep temporal nerve, and nerve to lateral pterygoid. 1 sensory branch is the buccal nerve. Same are the arteries. Easy? Yes. Come on. So what are the branches from the second part? 1. Masseteric artery. Second, deep temporal artery. Third, artery to the pterygoids. And fourth, buccal artery. So masseteric artery, deep temporal artery, artery to the pterygoids, and the buccal artery. So these are the branches from the second part of the maxillary artery. Perfect. Now coming to the third part. So second part of maxillary artery corresponds to the anterior division of mandibular nerve. Just remember it like that. Now coming to the third part of the maxillary artery. Third part. The third part is slightly difficult. Just make a mnemonic and remember this third part. Third part gives, number 1, posterior superior alveolar. Posterior superior alveolar artery. Infraorbital. Okay. Posterior superior alveolar, infraorbital, greater palatine. Pharyngeal artery. Just remember, just make one first letter of each and make a mnemonic out of it, so you'll remember it. Posterior superior alveolar, it supplies the upper and the posterior part of the teeth. Posterior superior alveolar, infraorbital artery gets out from a foramen just below the orbit. That's the infraorbital foramen. The artery comes out from here. The artery is the infraorbital artery. It comes with a nerve. The nerve is infraorbital nerve. The third one is greater palatine artery. The fourth is pharyngeal artery. Students, very important. MCQ comes Pharyngeal artery is a branch of. Pharyngeal artery is a branch of. Student, write it as external carotid. External carotid. Remember, the branch of external carotid with the name pharyngeal in it. What is that? It's ascending pharyngeal. Ascending pharyngeal. So ascending pharyngeal artery is a branch of external carotid. Remember, students, remember, ascending pharyngeal is a branch of external carotid, whereas pharyngeal artery is a branch of maxillary artery. Clear? Pharyngeal artery is a branch of maxillary artery. Ascending pharyngeal is a branch of external carotid. I hope this is clear. That's a very important MCQ. Fifth, artery of pterygoid canal. Artery of pterygoid canal. And the last one is Sphenopalatine. Sphenopalatine artery. Now, this third part will go between the two heads of lateral pterygoid. It would enter the infratemporal fossa, and this branches, it would enter the pterygopalatine fossa. I'm so sorry. And it gives this branches there. Clear about the maxillary artery, students? You just need to know this about the maxillary artery. What is maxillary artery? What is the course of maxillary artery? And what are the branches of maxillary artery? And who divides it into three parts? Clear to all of you? Okay, look at this. Look at this. So this is the part which lies on the lateral pterygoid. So that's the second part. That's the first part. And look at this third part, which is entering in the pterygopalatine fossa, right? That's the maxilla. That's the pterygoid plate. That's the pterygopalatine fossa. The maxillary artery is entering into the pterygopalatine fossa. Is this clear? Answer this. Which is not a branch of first part of maxillary artery. Any guesses? So deep auricular, yes. Deep auricular is a branch of the first part. Middle meningeal, inferior alveolar, yes, these are the branches of the first part. Which is not a branch of first part is greater palatine. It's a branch of third part of maxillary artery. Third part. Clear to all of you, students? I hope this is clear to all of you. Fine. So once again, in short, maxillary artery, it's a terminal branch of external carotid given in the parotid gland, runs deep to the ramus, enters the infratemporal fossa, lies on the lateral pterygoid, divided into three parts by the lateral pterygoid. The first part from its beginning to the muscle, second part on the muscle, third part between the two heads of the muscle. First part branches deep auricular, anterior tympanic, middle meningeal, accessory meningeal, inferior alveolar. Middle meningeal enters the skull through foramen spinosum, accessory meningeal, foramen ovale. Inferior alveolar enters the mandibular foramen with inferior alveolar nerve. Second part of maxillary artery corresponds to the anterior division of mandibular nerve. So what are the branches? Mesenteric artery, deep temporal artery, artery to the pterygoids, and the buccal artery. And the third part gives, yes, posterior superior alveolar, infraorbital, greater palatine, pharyngeal artery, artery of the pterygoid canal, and the sphenopalatine. So students, a total of 15 branches given by our maxillary artery. One of the maximum number of branches that any artery gives. That's the maxillary artery. And this maxillary artery enters inside the face. It goes inside the face. In the olden days, this maxillary artery was therefore known as the internal facial artery. Internal facial artery. Remember this. Maxillary artery in the olden days was known as internal facial artery. I hope this is clear to all of you, students. Very clear. Be very clear with the branches. Make a mnemonic for the third part. Second part corresponds to the mandibular nerve. First part, you know the branches. Perfect. Students, I hope this maxillary artery is clear to all of you. In case of doubts, do get back to me. Thank you. Happy learning till then. Thank you to all of you.